so we have people from United States who support our efforts here. Also at our opening ceremony, Walter Rocca from Rochester, the very famous epidemiologist, will be with us. Thank you very much for your participation, and I give you now the podium.
Thank you so much, and hopefully you can hear me and see my slides, and we did test it. Everything's good. Excellent.
Everything is okay. You can start.
Excellent. Well, such a pleasure to be with all of you, and I wish I was there in person. I am joining you this morning from Chicago in the United States, and I'm looking forward to sharing a little bit with you about the Alzheimer's Association, our programs and initiatives, and opportunities to get maybe more involved if you're not already involved with the Alzheimer's Association. So just a little bit to set the stage about who we are. The Alzheimer's Association is a voluntary health organization with a vision of a world without Alzheimer's disease and all other dementia. We work closely with the Alzheimer's associations around the world, including in Greece. But we have, I think, and what I'm going to focus on today is very much our research program, which is international in reach and scope. So our research strategy, and when we look at our research strategy, we look at opportunities that we can seed novel and new ideas, that we can speed something forward, or that we can scale something up. So again, thinking in that global landscape, and what do those opportunities look like? In the United States, this also includes some of our public policy and advocacy efforts to increase funding at the federal level, but we also then participate in some of those global conversations around the need for increased research resources more broadly. The Alzheimer's Association convenes a society called the International Society to Advance Alzheimer's Research and Treatment. And this is really led by volunteers around the world, including, as you can see here, we have quite a robust membership from Greece. There are over 8,000 members that are bringing together this global community, and they're talking about and sharing the latest information on science. Now, I will note that this is free for students, so please encourage your students to participate. Great opportunities to connect with the global network that's working in the areas that they may be working in. One of the benefits of being part of iStart is membership or subscription to the Alzheimer's and Dementia, the Journal of the Alzheimer's Association, as well as reduced fees for publication in the open access companion journals. There are other resources around publishing and around some of the translation services that are also offered. This Alzheimer's and Dementia is the top journal in clinical neurology, that's a disease-specific journal. But we also have these two other specific journals, one on diagnosis, assessment, and disease monitoring, and translational research and clinical interventions. You can find more information about these on their website, but also feel free, this is an opportunity if you're working on something to reach out to the editorial team, the Alzheimer's Association. That is, all those decisions are made by the editorial team, not by the Alzheimer's Association, but it's an opportunity to engage in that conversation with the work that you're doing. Now, one of the other benefits of iStart is an opportunity to come together in ways around common area interests. So we call these professional interest areas, or PIAs. And again, a great opportunity for those of you just emerging into this field to take advantage of leadership opportunities, perhaps organize a webinar, take some of those advantages and connect with colleagues on the global level that may be doing work, or at the institution just up the way, or the organization just up the way from you. We often hear that sometimes there are people maybe working on similar things at different institutions, maybe in the same city or in the same country, and they weren't necessarily aware of each other's work. Now, I mentioned student membership is free, and then there are reduced fees for individuals in low and middle income countries. So I'd encourage you to check that out. Now, one of the other opportunities to get engaged is the ambassador program. And this is the iStart Ambassador Program, which is for students and early postdocs. It provides an opportunity to volunteer, but also with experiences such as registration and meeting attendance, travel attendance to certain meetings, including the Alzheimer's Association's International Conference. Applications for this program open on February 14th. So again, an opportunity for students or postdocs to participate. And this is, again, open globally for individuals around the world. We look to have representation from all corners of the world in this particular program, as well as in all of our programs. One of the roles that the ambassadors play is at AAIC, the Alzheimer's Association's International Conference, which is the largest convening of its kind in the world. Now, while we've passed the deadline for the primary meeting, there will be a late breakers in terms of emerging topics and developing topics in April. So again, an opportunity to present your research. Now, one thing I will note for future reference is that if you do consider applying to the Alzheimer's Association or submitting your research to present, and you do it within the main conference window, there is an opportunity to apply for travel fellowships. And we offer many of these throughout the year, again, all the way from just registration through registration, travel, and the full thing, an opportunity to take advantage and network and participate in this conversation with researchers globally. But that's only one of those opportunities. There are actually year-round opportunities to learn and network. And while the next few are primarily in North America, that is, typically these are around the world. There's a meeting focused on ApoE and the role of ApoE in Alzheimer's and other dementias in different populations in March. There's another meeting focused on immunity. These are both being offered virtually as well. One that I want to highlight, and I'll talk in greater detail about in a moment, is Neuroscience Next. And then we also convene satellite symposia, which I'll also talk in greater detail about. So the ApoE and immunity, you can see the specific dates. For more information on registration, you can go through, you can use this QR code, or you can look at this website right here. There is a registration fee, although again, there's reduced registration fees for individuals from lower and middle income countries or iStart members to attend. In some cases, these become freely available opportunities, and they are virtually available. Now, Neuroscience Next is a unique opportunity really targeting and aimed at engaging students and early career researchers. It's a great opportunity to showcase your work, have that first poster presentation, go through that process, whatever you might be working on. And it could just be describing your study. It's not necessarily about data. It's really about that experience, building your network, building your community as you continue to advance your career and the work that you're doing. Now, AAIC Satellite Symposium, these are really opportunities for us to have, to bring the research community together globally. The next one of these will be in Mexico City in May, and we do this in collaboration with the Global Brain Health Institute and the Atlantic Fellows for Equity in Brain Health. Now, while the next one of these meetings is in Mexico City, we've hosted these around the world. In 2020, and then looking towards 2021, we certainly tried to have an opportunity of hosting one of these in Greece, and perhaps there'll be an opportunity for another meeting in the future. And we're really grateful to Dr. Magda Tittlowski for helping us with that meeting and really ensuring that we were highlighting and spotlighting the amazing work that's going on across the Mediterranean region in Alzheimer's and dementia science. And hopefully there'll be other opportunities in the future that we'll be able to have this type of meeting and convening and collaboration with the Mediterranean region. Now I'm going to dive a little bit deeper into our funding. As you heard, we are the largest nonprofit funder of Alzheimer's and all dementia science in the world. We fund the entire spectrum of Alzheimer's and all dementia. So while we're the Alzheimer's Association, our portfolio and everything that we do in research is really the full class of Alzheimer's and all other dementia, the AD, ADRD family of diseases that cause dementia. When we have a number of grants that are available throughout the year, and specifically, I want to talk about the grants we have open right now. These are grants that are programs that are open for early career and new to the field researchers. So early career, these are individuals in their postdoc all the way through when they become a newly independent researcher, so have their own lab and move things forward. New to the field is for individuals that are perhaps from another discipline, but that want to work in Alzheimer's and dementia research. Now, the letters of intent, so these are the pre-proposals, they are available, they're open right now and accepting letters of intent. So please check out alz.org grants for more information on these programs. I'm going to talk about them at a very high level in the time that we have this morning. We have programs that are about the clinical clinician scientists. So these are for individuals that see patients. These are individuals kind of just past their residency or their fellowship perhaps, or during their intern time, all the way through when they become newly independent scientists. Our research fellowships, these are really for like postdoctoral fellows or those that are not newly independent, but that are within that window of time following their terminal degree, but not yet at a faculty level. I mentioned the new to the field. These are individuals that have or are coming from another discipline at any stage in their career and want to apply their expertise in Alzheimer's or dementia. And then our research grants, these are for individuals that are at that newly independent stage of setting up their laboratory or moving forward to apply for these grants. So a little bit about how to kind of know where you might fit is that looking through this chart where you might be in terms of what your degree is or your level or your professional level. You need to be within 13 or 18 years, or if you're new to the field, you can be any years from the terminal degree, where you might best apply or best fit. But of course, our team is here to help answer those questions. So I encourage you to reach out, ask at any point in time. And again, these applications, the process for this is open right now. So reach out, let us know you're interested, and we're happy to talk through what might be a fit for you or where you are in your particular career. The other opportunities that I want to mention is throughout the year, we offer programs that are at all other stages or other specific areas as well. Now, in a given year, we offer anywhere from 20 to 25 different funding programs, with our early career and new to the field being offered twice a year. Other programs that are in process right now, we have Zenith Fellows. This is for more established researchers that have provided expertise or insights in the past, and then they're looking at doing something innovative and novel to continue that. It's more focused on the basic sciences, so more the discovery science. The Discovery Funding Program is looking to use and leverage model systems that have been previously developed with other funding and looking at those going forward. Both of those are in active review right now and not accepting additional applications, but look for them in the future. Two other programs that are open right now and are accepting those letters of intent. One is a program focused on sex and gender, so understanding the role of biological sex, gender, or gender identity in Alzheimer's and other dementia. That program is open right now for individuals at all career levels, and letters of intent are due on February 15th. Endolysosomal dysfunction in Alzheimer's, or is also accepting applications, and these are really more focused on the basic biology, but could be really through the biomarkers and some of the other ideas or areas. And the letters of intent for that program are due on March 2nd. So again, you can find more information at alz.org grants, or you can reach out. And I encourage you to strongly reach out if you have questions or you have ideas about these programs to see if they're a fit. We do have other programs that we anticipate coming soon. One is called Parts of Cloud, which is really for phase 1 clinical trials. While we don't have any of those that we funded in Greece, we have funded those in Italy, Spain, and other parts across Europe. I don't think we've actually had any applications from Greece that I remember. So again, these are for phase 1, phase 2 clinical trials. The TPEP program is really looking at drug discovery, drug development. So these are opportunities that are really from the stage of moving something into drug discovery or drug development past the screening of a potential compound, but before you get your regulatory permission to move into human trials. We will be launching that program later this summer. And it's specific for things that are within that window of time, but that are focused around tau or tau-related biology. Another opportunity within the grant funding is one, apply. We encourage you to do that. We'd love to see more funding and more opportunities for funding throughout the Mediterranean region, but also participate as a reviewer. This is a great opportunity to both learn what's happening in your space, but also to refine your own funding applications going forward. These are just some of the examples that we've heard from reviewers, really particularly those in the earlier stage, that allow them to become better grant writers as they go forward as well. And again, if you're interested in this, reach out. We'd love to welcome you to that process. So I mentioned a few times the letter of intent. That's the first stage. All letters of intent for all of these applications are reviewed, and they're reviewed by those peer reviewers that I mentioned. And a fraction of those are then invited for full applications that also go through review, go to a review panel. And these are all opportunities both for submission, but also for review, and ultimately moving forward with final award selection. And just to give you a flavor of the diversity of the types of funding that we have, that we really fund the full spectrum. This is looking at the biology, but the same is true in terms of care research, looking at psychosocial interventions, looking at interventions through the clinic. It's the full spectrum and the full portfolio of science that we fund throughout. A couple tips for success: read the program announcement and reach out. We're here to help you answer questions. Our goal is for you to be successful. Your letters of intent are reviewed, so please ensure that. And again, happy to give you tips on that. Find somebody that's good at reading grants or that's reviewing grants and have them give you some insights to apply. You have an opportunity, if you submit a full application, to identify reviewers to include or exclude. And if you're not funded in the first time, read and pay attention to the critiques in the submission. What was happening? What were perhaps the reviewer's perspectives in reading your application? And we're always happy to have a conversation based on all of the applications that we see. And again, I can't say this enough. Reach out, call or email if you have questions or you want to talk something through or something's not clear. And again, grantstaff@alz.org, and our team tries to answer that. I wanted to just take 2 minutes and address a couple different initiatives that we're working on beyond our funding and beyond these other works. You heard in the introduction around an international consortium to understand the impact of brain. There's a very active collaboration with some teams in Greece, but also throughout the Mediterranean, and we're very grateful for that as we continue to move some of this work forward. And it's an opportunity to engage. So if you're working on some of this type of research, again, reach out. You can use the Grants app email, or you can email me directly. My email address was on the front slide, but I'm also relatively easy to find. And then I wanted to just mention, as we enter this new phase of treatment and diagnostics, both in the United States, but also around the world, the Alzheimer's Association is really looking, how can we capture the real world data and move that forward? In the United States, we've launched something called ALZNet, or the Alzheimer's Network for treatments and diagnostics, to collect that real world data as treatments move into the clinic. We are talking with different international partners. So if there is a space that you start to move in that direction, we would welcome that type of global collaboration as well. And with that, I think I hit my 15 minutes. Thank you so much for the time, for having me. I really wish I was there with you in person. I'm sure your weather is a little bit nicer than ours is here in Chicago. And I can't emphasize enough, please reach out, ask questions. We'd love to see your applications. We'd love to see more research that we're funding and that we're working with in the Mediterranean region. And so have your ideas, bring them forward. If something doesn't feel right or look right in our programs, ask. It may be that there's a program coming soon, or it may be that we can talk with you about how to make it fit within one of our funding programs. Thank you so much, and I look forward to the discussion.
Okay. Dear Snyder, thank you very much for your presentation. As we all know, Alzheimer Association is the care and scientific leader of all the world. I had the opportunity to start my work on Alzheimer's disease in 1994 during a conference in Minneapolis, the 4th conference of Alzheimer Association. And I think that there is no other scientific conference or scientific group in the world which does so much work in research, in care, in everything about Alzheimer's disease. And so thank you very much for being with us today, and give the opportunity to the new people in Greece, but also the other people who came from other countries, European countries, and other area countries to be with us. If there are any questions, please. Are there any questions to Snyder? As you understand, there are many opportunities to find funding in order to do research in our countries. We have to try. We have to try to work hard in order to succeed, because the opportunities are many, but we have to work hard in order to succeed.